What is up, everybody? This is going to be the last of the special populations chapter, exercise and obesity, and really going into some of the details, minor details of some of the safety aspects, some of the recommendations for testing, and also meeting some goals for people who are obese, and some of the precautions to take. We've already gone over some of it early on in the semester with the body composition chapter, so we're not going to go too far into detail with some of the material, but just to kind of give some more recommendations and some procedures to follow, some basic recommendations and some basic procedures to follow for exercise in obese individuals. Everyone's going to be a little bit different. Every obese individual is going to be slightly different in what they can perform, what their limitations could be because of maybe other conditions. One thing to keep in mind is that if somebody is obese, it's likely just not obesity, especially if they're getting older and older, if they're in their 30s, 40s, 50s, and even older. More than likely, they just don't have just obesity. They probably have hypertension. They may have a heart condition. They may have type 2 diabetes. They may have peripheral artery disease, high cholesterol. There could be a myriad of other issues that they have, and they could be on a lot of medications as well, which can limit some of the responses to exercise. So keep that in mind also, and that's going to be case for another, another chapter or another even just semester of looking at different medications for that. And that would be something to look into later on and get into some of the specifics if we had time for it. But we don't have time to go into all the different medications because it's all going to be different for each individual and what they have, and maybe some of the interactions they may have even with the food and the absorption rate. So not going to go into that. That could be go down a huge rabbit hole that I did in my undergrad, and it was terrible. It was a lot of work. It was a lot of work in one semester to try to memorize all the different interactions with food and nutrients and all that kind of stuff with different medications. So anyway, exercise and obesity chapter number 20. If you have any questions, hopefully I answer them during the lecture or after the lecture. And if not, go ahead and email me, do whatever you'd like to do. And here we go. Chapter 20, exercise and obesity. We've already looked at obesity and overweight issues way back earlier in the semester with body composition, but we're going to go into a little bit more detail with it in this chapter. So the definitions of obesity, looking at the BMI standards, and we've seen this before, again, previously in the body composition chapter. So it's really excessive adiposity or adipose tissue, that's subcutaneous fat tissue. So obese class 1 is 30 to 34.9. Obese class 2, 35 to 39.9. Anything over 40 BMI is considered class 3 obesity or extreme obesity. Another way of saying it is morbidly obese, meaning that it is likely to cause other diseases and potentially even death. Percentage of body fat and waist circumference. There's no universally accepted and agreed upon standards to actually classify obesity by the percentage of body fat. There are some averages and some ranges, though, in women and men. So greater than 38% is commonly considered obese for women, and greater than 25% for the men. Now, waist circumference can be a tool to identifying maybe some abdominal adiposity, but again, there's no set standard in general, but there are some recommendations. Abdominal circumference below 40 in men and 35 in females. So anything over those two numbers can be considered excessive and potentially leading to obesity or the result of obesity. And the potential causes of obesity. Now, we've gone into some of these previously, but from a physiological standpoint, it is an energy balance disruption. So the energy imbalance is the ultimate cause, regardless of any other factors. There could be a genetic predisposition, however, so lower than normal metabolic rates. It could contribute 25 to 40% of variance in body composition. And some of the hormones that are disrupted could be something like leptin or other hormones to cause variations in the metabolic rate. Could also be psychological in nature, which is a body image disorder. And looking at the prevalence of obesity, we've seen an increase over the years, especially even in the past 15 or 20 years still. Now, this chart is really looking at around a 13-year period or so, but an increase of abdominal obesity even in the early 2000s and going into the tween period And problems associated with obesity, there are many of them. There is an increase in mortality and morbidity, so death and disease development, coronary heart disease, congestive heart failure, stroke, type 2 diabetes, hypertension, dyslipidemia, and dyslipidemia being too high of fat content in the blood. And that's also describing high amounts of bad cholesterol, low amounts of good cholesterol, and total cholesterol being increased as well. Gallbladder diseases, osteoarthritis. There's a lot of stress on the joints, being overweight and obese. Some types of cancers, breast and colon cancers, some of the common ones. Also, sleep apnea and other respiratory conditions can be caused or exacerbated by obesity. Now, looking at the treatment for obesity, physical activity is really a key factor. Other ones would be overall healthier lifestyle and nutritional habits. But focusing on physical activity, leisure time and workplace physical activity are inversely associated with obesity, meaning that if the leisure time and workplace physical activity goes up, the obesity rate goes down and vice versa. Now, 45 to 60 minutes of daily moderate activity is needed to prevent obesity. Now, this is an average number. This isn't set in stone for every single person alive, but on average, about 45 to 60 minutes of that daily moderate activity tends to decrease the prevalence of obesity. But that 45 to 60 minute of daily moderate activity is needed to prevent obesity. So both exercise and dietary modifications need to be optimized. These are the major two factors in treating obesity. There's the lifestyle change in general, but that branches off into physical activity and dietary modification. Diet and exercise, who would have thunk it? Looking at screening the clients and screening them carefully. So obesity is linked to other common comorbidities, such as hypertension and type 2 diabetes. There could also be some heart disease that is associated with it as well. So some medications for both conditions may actually require close monitoring of the client themselves during the exercise as well as after the exercise. And adjusting the exercise prescription and intensity and duration based upon how they are reacting to it. Again, medications are going to limit some of the exercise capabilities of some individuals. Some testing considerations for an obese client. Standard testing modes and protocols may be used. Some of them may be able to be performed by obese individuals, but excessive weight often reduces cardiorespiratory functioning. They are probably deconditioned. That's probably how they got into the obese class to begin with. Not always, but that's likely the case. Testing should be individualized because some may be able to perform certain activities while others cannot. And keep in mind that could be different age ranges as well. Also take into account any special needs that they have and looking at the initial intensity from the client's current fitness status and activity level. And really cycling and arm ergometry may actually be preferable over treadmill because they're not standing upright and they can maybe take more breaks without risk of maybe falling over or collapsing. So focusing on weight loss, the improved fitness levels, and the reduced risk of chronic disease. Getting them active and staying active is going to be the key here of weight loss. The weight loss will come. It's an important factor here, and that's the overall goal. But the major problem with all of that weight is likely there is a increase in all of these other diseases. So that's what we want to try to reduce is the risk for developing those diseases. Or if they have a disease such as type 2 diabetes, reducing the symptoms of that disease or potentially curing it depending upon how much weight is lost. Now, you might not cure heart disease, especially a progressive heart disease that has gone on for years and years, but you're going to reduce some of the symptoms potentially and maybe reduce some of the more progressive forms of it. So 200 to 300 minutes of moderate activity per week for long-term weight control. And we have the fit recommendations down below, the frequency, intensity, time, and the type. So 5 or more days per week and the initial moderate 40 to 60% heart rate reserve with the progression to higher intensities greater than 60% heart rate reserve. So we're looking at maybe 12 to 14 or 15 on the Borg scale. So beginning with short, easily tolerated bouts, preferably maybe 30 minutes a day. Then after that, progressing to 60 minutes per day. Multiple daily bouts can be used. Breaking the time up 5 to 10 minutes per session is important sometimes. Because keep in mind, these are likely deconditioned individuals. They are not cardiovascularly trained. So they may not be able to go for very long periods of time. So splitting the exercises up into short bouts and then increasing to longer and longer bouts. Aerobic exercise, targeting large muscle groups, resistance, and also flexibility exercises can be recommended as a supplement to the aerobic activity that is performed. Some other considerations for obese exercisers. Safety is also important for everybody, but in particular obese exercisers, because they are carrying around a lot more weight, so there could be more risk injury. So reducing the risk for any type of orthopedic injury. Thermoregulation could be problematic. They have a lot more fat, a lot more insulation. They're going to be sweating more. They're going to be losing more water weight. They could become dehydrated quicker. So making sure that they have enough water and they're taking breaks when necessary, and maybe even in a cooler climate, at least to start off, or more of a temperature regulated environment. Exercise carries health benefits, however, so regardless of whatever the changes are in body weight. The weight loss is important, but we're really wanting the health benefits. That's the great aspect of this type of treatment for obese individuals, is that yes, they're going to lose the weight eventually, but also keeping in mind that it's the health benefits moving forward that are the most beneficial. This is where I think sometimes some of the TV shows, the biggest one being The Biggest Loser, kind of misses the mark sometimes. They've gotten better with the most recent season of it, or most recent iterations of it. But at the start, it was more about the weight and not the health benefits. I digress. So lower blood pressure and improved blood lipid profile, decreasing cholesterol levels overall, increasing good cholesterol, decreasing bad cholesterol, decreasing triglycerides, and even only a 5% reduction in body weight, these things can occur. And you can make the point that 5% reduction in body weight doesn't seem like a lot, and it might not be a lot to a certain person, but the lower blood pressure, improved heart rate response, improved lipid profile is just as beneficial, if not more beneficial, than the weight that has been lost. And looking at meeting weight loss goals. So set reasonable weight loss goals, 1 to 2 pounds per week, which is roughly a half to 1 kilogram per week. Just like in England, we do kilograms and not pounds. We do pounds in money, but not in weight. So creating a caloric deficit of about 500 to 1,000 kcals per day through combined dietary and activity changes. It doesn't mean reducing the overall caloric intake from what they're normally doing by 1,000 kcals per day. But you can use the combination of dietary decrease and activity increase to get that 1,000 kcals. So helping the client create a program that is realistic, that is enjoyable, something that they really truly enjoy. Now it's going to be tough, it's going to be difficult, there's going to be stress, they're going to be sore, but making it somewhat enjoyable, having fun with it, and also somewhat convenient. If you need to split up the times throughout the day, throughout the week, just as long as they're getting that activity. Chapter number 20, exercise and obesity, short chapter, and you'll be seeing me for the wrap up here in a second. Okay, welcome back. Exercise and obesity. Don't want to get off too much of a rant here because I've already done it actually in class way back when we actually met for class. That was, oh my goodness, it feels like years ago now. But getting into things like The Biggest Loser. And I touched on it at least a little bit in the chapter, and at least starting off, even though that in the show, the Biggest Loser, if you haven't watched it, basically a lot of people who are overweight, well, they're actually, a lot of them are obese. They would definitely be in the class 2 obesity, probably. Some of them might be class 1, but a lot of them are class 2, or maybe even morbidly obese. And it's basically, a competition. And it used to be, I think they would get hundreds of thousands of dollars. I can't remember how much it was, but it was something like $300,000 or $400,000 that they would win if they were the biggest loser, if they lost the most amount of weight. Now, even though that they touched on a lot of the health benefits that they were getting, even if they didn't lose a lot of weight, even if they were potentially maybe gaining some weight because they were maybe gaining some muscle mass, they really focused in on the weight. I mean, it's part of the competition. It's the major part of the competition is the weight loss. So they get on the scale and you have it go up and down and be like, oh my God, what's going to happen? The blue team and the red team and all this other stuff. Oh my goodness. Even though that was good, it's good for entertainment. And, yes, it's still good what they were doing, kind of. I think the new iteration of it, they're really focusing on the health benefits and more the psychological aspect of it. Not to say that they didn't focus on that before, but they didn't make it something that was paramount, that was out front, that they talked about a lot. And that was the biggest issue that I had with it. The other issue that I had with it was they lost the weight so quickly. And you go back and see some of the stories of the individuals who lost a lot of weight and look like they changed their life for the better. But then you go back a year or two later and they've gained back most, if not all the weight, and sometimes even more of the weight than they had originally. They basically crash dieted. They crashed exercised. They were in this bubble that was, it was the trainers in their face. They had to do it. It was the competition. It was part of it. Even though they may have extended some of that stuff that they had learned after the show to their regular life, they somewhat reverted back to what they were initially doing. And the problem with that, with losing weight that quickly, is studies have shown over and over again that losing the weight really quickly is basically in the crash diet situation is what they were doing. Most people will gain it back and likely gain more of it back, even maybe up to 10% more. And when we talk about losing weight slowly, it was in the last part of the presentation there. We're talking 500 to 1,000 kcal per day deficit. That doesn't mean that somebody needs to take out, say if they're on a 3,000 calorie a day diet, they need to go down to, say, 2,000 calories. They could go down 500 calories and burn 500 more calories through physical activity. So they don't need to crash diet and exercise. Now, if they do that, which is basically what they're doing in the show, they're going down to really low levels and they're exercising a lot throughout the day, then yeah, you're going to lose a lot of weight. But the other thing is you could also be gaining some muscle mass. And at least initially, a lot of that weight that people were losing was water weight. It is very difficult for somebody to lose 12 or 14 pounds in a week. That's a lot of calories that they would have had to burn. That's a lot of calories. A lot of that is going to be water weight. So that was one of the biggest issues that I had with it. And there was a couple of contestants there that had, I don't know, there was, at least for me, it was somewhat unhealthy, and it was a projection on health, and it was just bad. There was a lot of things that I didn't like about it. Now, again, I think it's good that it would potentially get people up and moving and change their life and everything. But there were some things I think that they missed. And I think the new iteration of it, at least from what I've seen, I haven't really watched it religiously or anything like that, but at least from the new iterations that I've seen, it is better. They look more at the person, the individuals, their life. And I think that's more beneficial than just looking at the total weight on a screen and a scale. That's more beneficial. That's far more beneficial. The weight will be lost if someone continues to do it, if they continue to change their eating habits, their exercise habits, but the health benefits are the most beneficial. If somebody is obese and they have type 2 diabetes, even just one bout of exercise increases their insulin sensitivity. That's the whole issue with type 2 diabetes, is the insulin sensitivity. So if you continue to do the exercise, the insulin sensitivity will be improved. Even with one bout of exercise, if they continue to do it and they lose the weight, we know that if they lose even up to 10% of their body mass, their fat mass, somebody who's obese and has type 2 diabetes, and likely the two go hand in hand, their symptoms of type 2 diabetes goes away. At least most of them go away. A good portion of them go away. Excuse me. And sometimes someone will lose enough weight where they never have any problems with type 2 diabetes again. So it has a lot to do with, there's a large correlation between abdominal obesity and type 2 diabetes. And that's where it's at, where they lose the weight overall. They just don't lose it in their stomach, but they lose the weight overall, and they're improving their insulin sensitivity. And the fact that by doing that, losing the weight, but also increasing the physical activity, changing their eating habits, maybe eating different foods, healthier foods, preparing the foods better, they are going to reduce the risk for heart disease later on. Just a whole myriad of diseases that they could be reducing the risk for. And again, that's the most important aspect. The weight will come, the weight loss will be there eventually. But at least initially, I know everyone we kind of live in this microwave society where we want to drop the weight now and that's it. Within a week, we want to lose 20, 30 pounds. Well, it's just not going to happen. Well, you could do it and start cutting off limbs and different pieces of the body. Then yeah, you're going to lose a lot of weight pretty quickly. But in terms of exercise and diet, man, it is really, really, really difficult to lose 10, 12, 14 pounds in a week. That's where the recommendation of 5 to 1,000 kcals per week, maybe up to 2,000 kcals, or at least, up to 2 pounds per week. So that's really where it's at. So 3,500 calories is equal to approximately 1 pound of fat. So that's where the 1,000 kcals is coming from, about roughly 2 pounds of fat there. So 1,000 times 7 gets us 7,000, and then 3,500 divided it by 3,500, that's 2, which would be 2 pounds of fat approximately. It's an approximation. So, and also we went over some recommendations, some considerations with an obese client, some things to keep in mind. But anyway, that was a little bit of a rant there. Again, I like to go on it because I think it's important that somebody who is obese, they really start to focus on the lifestyle and the health aspects of it, just not the weight. Again, the weight's going to come, weight's going to be there. So anyway, I hope you enjoyed the chapter. If you have any questions, leave them down below if you want to. If not, thank you for watching, and see you, everybody. See you.